Hello, Ahlan and Assalamu alaikum. Welcome to another episode of Sash Health. I'm your host, Dr Hamza Shaikh, and I want to begin this episode by thanking all of you for liking our videos and subscribing and even sharing them. The last episode was particularly an amazing feedback we got. So that basically triggered us to talk a little more about this same topic, which is advice to doctors coming to the UK. And we'll specifically be answering some of the questions and doubts asked by our viewers. So without further ado, let's. So there were quite a few questions that were asked and doubts raised by the viewers, and I've just put them in order of relevance, I should say. So let's begin. So first one was about routes to registration in the UK. So the registration body in the UK is the GMC, or the General Medical Council, and every doctor that's working in the UK needs to have a license to practice. Now, that means your name has to be on a register. There are many kinds of registration. So there are basically 5 kinds of registration. Number 1 being the provisional registration, then full registration, specialist registration, GP registration, and lastly is registration that is gained via or acquired via sponsorship. So let's very quickly just touch on each one of them. Provisional registration is basically for FY1s or F1s, as you may know, that are basically starting their medical career. Whether you are you're starting from the UK, that is, you have graduated from the UK, or coming from the outside, but basically joining as an FY1 doctor, you'll get provisional registration. Next is full registration, which also when you get a certificate, or it'll be known as full license to practice. So that means you're anywhere above an F1, so that is from F2, say, all the way to a middle grade or even a specialty post. And some of the consultants who are locum consultants would also be on the same register. Most of the doctors coming to the UK would be on this full registration. And we'll talk about how to get that, and we'll share some links as well. The third kind is specialist registration. You can get specialist registration, which it might be a little confusing because in some countries where you're coming from, specialist actually means somebody who has finished training. But here in the UK, it means somebody who has finished their training and is at consultant level posts. So it's just a different terminology. So you get specialist registration after you have finished CCT from the UK or equivalent qualification or training from outside the UK. And so that's specialist registration, and you basically are practicing as a full consultant, and that applies to almost all the specialties. Fourth is the GP registration, which is exclusively for general practitioners. So if you want to practice as a fully independent general practitioner anywhere in the UK, you have to be on the GP register, which is equivalent to a specialist register, but specifically for the GPs, if that makes sense. And lastly is what we talked about, what I mentioned earlier, was that of sponsorship. So sponsorship means that GMC has already approved certain institutes, certain hospitals, certain trusts to sponsor doctors from abroad. Of course, that meet certain criteria, and they basically sponsor them for a certain period of time. And you can go to the website that I'll be sharing in a bit, and every institute, depending on the post, will have a slightly different criteria. So these are the kinds of registration. So we talked about the types of registration, but of course you have to give some sort of equivalence exam or an exam to get onto the register, whatever register you're going onto. So that would be usually, more often than not, 2 pathways. One is going through the PLAB route, which comprises of PLAB 1 and 2, and or the other option is to go for the Royal College membership exams. So it will be MRChem for emergency medicine, MRCP for physicians, MRCP-CH for pediatricians, and so on. Of course, you'll have to give proof of your English proficiency, which can be via the OET or the IELTS route. And some of the trusts are actually providing exemption to English language as well. Of course, that is sort of temporary, but there are options out there, and your recruiter should be the best person to guide you on that. Now, moving on to finding jobs. So let's say you have registered. Like I said, most common form of registration is full license to practice or full registration. And once you've got that, now you have to be hunting for jobs. And there are usually two routes that are adopted. One is, of course, making an account on NHS jobs. And then you'll keep getting alerts about the kind of job you want. Be very careful about what you're applying for exactly, because there's so many names of posts here in the UK that you might actually be confused. So just do a bit of homework, and we could guide you a little more if you have any doubts on that. And the other route is basically going through recruitment teams, recruitment agencies. So what they do is they basically call you up after looking at your CV and ask what your preferences are, and they would basically help out what kind of job you're looking for and what would be the right place for you and where you should begin. Should it be at a senior level, or should it be at a more middle grade or a junior level? They'll be the best persons to guide you on that. Another question is about relocation allowance. It's very interesting, actually. This is, as far as I know, this is a very, very commonly sort of ignored area by whoever's coming to the UK. So people think that they've got the job, they're on the register of whatever sort, and they're getting whatever they want out of that job, and they're coming through. But this is often ignored. I've asked people who have actually come to the UK, did you actually ask for an allowance? And they said, no, we didn't even know this thing exists. No employer would actually tell you themselves that we've got this benefit, but every trust, every institute will have a relocation allowance policy. So it varies from trust to trust. Okay, so and it is very variable if you're coming on a training post directly. So you have to check on that. You can contact the hospital medical staffing, or HR as you may call it, for this purpose. Or if you're coming through a recruiter, they will be the best people to guide you to on this. So basically, you can ask for a relocation allowance. What I mean by relocation allowance could vary a lot. So it could be an all-inclusive package, or it could be something like that is very specific. So let me give you an example. So a full inclusive package would be basically anything that brings you from your country of origin or country of work to the United Kingdom at the place you're staying and the hospital that you're working at. So this means if all your shipping charges, basically all your luggage and stuff, or if you're getting furniture, let's say, shipped to the UK, your air tickets, a bit of taxi, any baggage allowances, so all that, basically anything that takes you from your country of origin, from that house or accommodation to the accommodation in the UK, is basically comes under relocation allowance, and that would be an all-inclusive package. If you get that, negotiate, it's going to be worthwhile. And secondly, it could be something very specific. So they could probably just say, we'll pay for your first 2 months of rent of accommodation. It could be things like, we just pay for the transport or your air tickets, or we just pay for your visas. So it would be something, but try to get as much as you can out of this particular thing, right? So get more and more of your relocation allowance, however it may be. So take care of it. So another viewer has asked about benefits of working in the NHS. So basically things like what benefits you get apart from your basic salary. So they're quite a lot. Let's talk about them one by one. I'd like to begin by talking about pension first. So I think the NHS pension scheme is pretty attractive in the long run, of course. In the short run, in the beginning, you might think you're losing a bit of money, but it's all about seeing what you get at the end of retirement, whether you're retiring at, let's say, 67 or you're retiring early, say 55. So there's a lot to read out there. It is on the NHS employer's website. But in a nutshell, the way it works is you contribute some amount from your salary, which ranges between 12 to 13.5% depending on your basic pay. That is every month, of course. So that, let's say you're contributing about £10,000 annually to the pension scheme, and your employer is going to be contributing a similar amount. So that means you're basically having 20,000 worth of pension annually. And if you see, like, you have a service of say 31, 32 years, so you can just do the math yourself and see if you're getting a very good lump sum amount, which will be between let's say 5 to 600k pounds. So that's quite a handsome amount of money. I think it's got a lot of advantages. So I would highly recommend whoever's joining, please go for it. Have a read on it, of course, do your homework and do the math, but it is highly recommended. So another benefit is study leave and study budget. So study leave is basically approximately or around 10 days. It will depend on the trust you're joining and maybe slightly variable on your contract, but it's about 10 days in general. And then a study budget. Study budget, depending on your level, will vary from 500 to £1,000 annually. And that basically you could pay that, or you could use that for your conferences, for courses relevant to your field, of course. So that is amazing. On top of that, the transportation that, or the accommodation that you are using for that course or conference is added on. So that's a part that comes apart from, or as an extra from, the study budget. So that's quite a good benefit. It's just how you use it and how you utilize it smartly, basically. Another very recent but very attractive scheme is that of salary sacrifice scheme. So the way it works is basically it applies to things like childcare, cycling to work, and low emission cars. So things like electric cars, and you know what I'm talking about. And it also applies to certain electrical appliances that you might be using at your home, or that you might be having in your daily use. So the way it works is, instead of paying it upfront or buying it from the store, let's say, you're kind of buying it through your employer. So you're getting, on a monthly basis, you're getting a certain amount of salary deducted before tax. So it's kind of a tax relief for you, and you end up saving that tax, basically. And at the end of the term, you would be saving between 25 to even 35% of the price of that entity, of that commodity. So that is something to look out for. So these were the questions that were raised by our viewers. Of course, if you have any more concerns, questions, or doubts in your mind, please do ask us, and we'll of course either reply to you in person, or if there are more than let's say 4 or 5 questions that need addressing, then we'll make another episode. That's not a problem. So hope that was helpful. The episode prior to this was advice to doctors coming to the UK, new doctors coming to the UK. So have a look at that as well if you haven't already watched that. And please don't forget to share our video, because the intention behind this is basically to help out doctors coming to the UK and even general public that are looking for some sort of advice. So I hope you liked the episode, and I hope you continue watching our episodes. I want to especially thank everybody for their questions and feedback, and a big thank you to the man behind the camera who basically does all the recording and does all the editing. So big shout out for him. So that's Abdul Rahman. We know him as Abdul. So thanks, Abdul. And we basically work on everything together. We come up with episodes together. We work on your questions, and we'll continue to do so. So take care then. This is Hamza Shaikh and Abdul Rahman signing off. Bye bye.